There's so many conversations that we've had about fertility, and some people really do worry about their fertility, especially if they don't really want to have their children today, but maybe sometime in the future. We've had quite a few conversations about, your eggs becoming less for women once you get older. For men, sometimes your sperm count can become lower, but women are taking a very different strategy to their fertility. Perhaps they feel young right now, or maybe they just want to do other things with their lives, career planning, traveling, just having a good time until that particular time that says, yeah, I think I'd want to have children now. But to try and bypass some of the fertility issues that may come up later in life, egg freezing has been a great option and an increasingly popular option for women seeking to preserve their fertility. And once considered an experimental procedure, it's now widely accepted and accessible, and it offers women greater control over their reproductive choices. We're talking about egg freezing this morning, exploring the medical, social, and emotional dimensions of this. Dr. Eglay Nyakoa is joining us on the line, a fertility specialist, to help us in this conversation. Dr. Nyakoa, thank you so much for joining us. How are you?
Fine, thank you. How are you?
I am doing well, thank you as well. For many people, they feel like, okay, how does this actually work? And why would you want to freeze your eggs? Where are these eggs and how can they be frozen? So let's start with the procedure itself. What is egg freezing? Where do the eggs come from? How are they frozen?
All right. So egg freezing can also medically is referred as oocyte vitrification, and that means that the woman's ovaries are stimulated by some medication to produce more than one, because normally every month only one egg grows. So we use some medications to stimulate the ovaries to produce more than one egg. And then once these eggs are mature, they are retrieved or retrieved outside the woman's body, and then they are frozen in the IVF laboratory.
Mm. And I'm sure,
Yes.
for someone who's a fertility specialist, it's not just the focus on the medical aspect, right? The woman actually freezing their eggs and what happens there. But perhaps you've spoken to a number of women who've come to get this procedure. What are some of the reasons behind women freezing their eggs?
All right. So the reasons why women are freezing their eggs now is that they can be categorized into two. One is the social reasons, and another is medical reasons. So mostly, most women are freezing their eggs for social reasons, and this could be one is the most common actually is women are not finding the right partners to sire children with currently, and then and with the knowledge of the biological clock, they are opting to freezing their eggs, and then later in life, if they find a partner that they can get children with, then these eggs can be fertilized and then they can carry a pregnancy. Another reason is because many women are pursuing their career, their professional goals, and women are doing so well nowadays. So in freezing their eggs gives them a pause. I call it a pause button on the biological clock, so that once they're established, once they have met their goals, then they're able to now take over the role of siring children. Another
Sure.
social reason is just some women are ambivalent. They're not sure if they want children now or
Okay.
later. So for that reason, they decide, okay, in case I change my mind or in case I decide I want children, then I can have that option. So egg freezing really is giving women reproductive autonomy, because there's the aspect of the biological clock, which really there's a time limit to childbearing. But then with the egg freezing technology, then women are able to postpone this later in life. So for the medical reasons, if someone is diagnosed with cancer requiring chemotherapy,
Okay.
radiation, then radiation and chemotherapy can affect the ovaries, affecting the eggs. So it's important that they get their eggs out and frozen first before they go through the treatment. Or if someone has endometriosis, for instance, and they require surgery involving the ovaries, then it's advisable that they do the eggs are frozen first prior to the surgical treatment.
Dr. Eglay, let's talk a little bit about preparing a woman for this egg freezing process. What would that be?
All right. So first, the woman of course, requires to book an appointment with their fertility doctor so that there can be initial evaluation, which involves some hormonal tests to check. One of the tests checks the ovarian reserve and also just their general health, if they're having any other condition, so that it's managed prior. And then once we have this, then we can plan for the process for egg freezing. So of course, it's also important that the woman, in the initial visit, the woman is advised on healthy eating. If they are smoking, they have to stop, to limit their alcohol intake, because these toxins can affect the quality of the eggs. So a bit of lifestyle modification prior to the treatment process.
Okay. And, do you look at the other signs of the health of that individual before going through the procedure itself? Would there be anything that can halt the procedure? Are there any health conditions that would stop any practitioners from allowing a patient to pursue egg freezing?
Okay, there are no outright contraindications or outright conditions that will prevent someone from undergoing the process of egg freezing. But it's important that if this person is having conditions like diabetes, hypertension, things that would complicate the treatment process, for example, the anesthesia during the retrieval, or things like obesity, then a bit of lifestyle modification is required before the treatment is initiated. But also of importance, if a woman has maybe conditions where they have blood clotting issues, then that has to really be managed first, because the treatment involves hormones which can predispose them to getting the blood clotting in case they have that condition and is not managed.
We are under the assumption here that any woman who chooses to freeze her eggs can do so. Is this a correct assumption? Are they either individuals or even eggs themselves that cannot be frozen? Is there a condition of the eggs themselves where a doctor would say, I don't think you can use these to be frozen?
Okay, very important question. So what really matters for women is age. So it's important that we discuss what is the right age, or what is the optimal age for a woman to freeze their eggs. Because if a woman showed up at 45, 46, and they want to freeze their eggs, then there's no point of freezing those eggs because of the issues of quality, especially genetically. So the age is what really is a limiting factor here. So a woman who is between, so the appropriate age, I would just mention, of freezing eggs is between around 27 to 34, because now, but a woman who is above 35 years old can also just freeze her eggs, although they'll require more cycles, which is more expensive, and also the quality of these eggs might not be good. So the age is really the limiting factor here, because a 46-year-old, even if there's a bit of ovarian reserve, then there's no point of freezing those eggs, because they will not give us, they are not good quality eggs. They will not give us a live birth, which is the desired outcome at the end of the day.
I see. Well, let's take a break. Apologies to stop you there. We need to take a short break, Doctor. We'll come back and continue speaking about the conditions of the eggs and how that actually would work. But the procedure itself is also quite important, and I'm sure a lot of people are intrigued to find out how that actually works. We're speaking to Dr. Eglay Nyakoa, who's a fertility specialist, speaking to us about egg freezing.
Gender-based violence is destroying lives and tearing communities apart. It happens in homes, in schools, at workplaces, and too often in silence. But it doesn't have to continue. If you see it, speak out. If you are hurting, reach out. Because doing nothing is not an option. Listen to all 19 SABC radio stations from Wednesday, 23rd of July for hard talk, discussions, advice, dramas, educational shows, and interviews around GBV with experts, survivors, lawmakers, and the whole country affected by gender-based violence. For all your favorite SABC radio stations, call 0800 428 428 to report abuse or get help. GBV, it ends with you. This message is brought to you by the SABC. Step into the heart of the day on the move with Palisa and Benjamin.
Hey, we're speaking about egg freezing today, and there are many reasons why women would want to do so. And Dr. Eglay Nyakoa is joining us on this one, a fertility specialist joining us from Nairobi, Kenya, already expanding on the reasons of career planning, delayed marriage, personal health considerations, modern life. These are some of the reasons why egg freezing has emerged, and we've also seen scientific advancements and a lot of people thinking this is the way to go. Dr. Eglay, let's speak a little bit about that issue that you were speaking about before the break in terms of what you consider when looking at the quality of the eggs.
All right, I just mentioned that age is actually a very important factor, and it's important to understand that women are born with a specific number of eggs that are depleted over the time until menopause. So these eggs, with age, the quality goes down and also the quantity. And this is what really matters in terms of the quality for the eggs for women.
And then the procedure.
And also,
sure. Okay. You can expand on it. I see you wanted to say something there.
yes, and also just lifestyle factors are important. Things like smoking really affects the quality of the eggs for women, excessive alcohol intake, and also just drugs. Yeah, they can affect the quality as well.
Okay, and then when did you start with the procedure? Because there's many false doctrines on different parts of the continent around egg freezing and how the procedure takes place. What's the correct procedure for egg freezing?
Okay, so the process can seem daunting, but it's very structured, and I'll just go through it step by step. So the initial part is the initial consultation and screening with your fertility doctor. And this is where the patient, you meet the doctor, discuss your medical history, and you undergo some blood tests, some hormonal tests, and also an ultrasound to have a look at your ovaries. Then once everything is fine, then the next step is ovarian stimulation. And this is whereby now medication is given. This is hormones are given to the woman, injections. Which takes around 10 to 14 days. And these injections will stimulate the ovaries to grow more than one egg, to grow multiple eggs in the ovaries. And then during the ovarian stimulation process, then there's monitoring. And this is where we do ultrasounds, we do blood tests to check and see are the eggs growing well, and to adjust the dosage as needed. Once the eggs are ready, because with an ultrasound, the doctor is able to tell when the eggs are ready, then the patient receives a trigger shot, and this is the last injection for final maturation. And then after that, 36 hours later, then the egg retrieval procedure is done. Egg retrieval procedure is a very simple procedure that is done under sedation. So the woman is made to sleep, not general anesthesia per se, just so that she's not able to feel pain during the procedure. It takes around 15 to 30 minutes, where a thin needle guided by ultrasound is used to collect the eggs from the ovaries. It's done transvaginally. Once the eggs are retrieved, then they are frozen, and then after freezing, they are stored in liquid nitrogen in the IVF lab. So here there's not even an aspect of power outages or anything, because they are stored in liquid nitrogen.
Okay, yeah. I see. Well, I'm sure there are many fears for women who've thought about going to the egg freezing process, but they're like, hey, I'm not sure. And I know one of those mindset would be, is it painful? I mean, the eggs are inside of me, so you have to take them out to be able to freeze them. How is that procedure, and is it invasive?
All right. So the egg retrieval procedure is it's done under sedation. So the woman is given some medication by the anesthesiologist, so that she's asleep, just to be made to sleep, although she's able to breathe by herself. So this medication prevents her from feeling pain during the retrieval. and the retrieval procedure is done transvaginally. So there's a transvaginal ultrasound that a needle is attached to. Then it's guided through the vagina. So the needle is guided to the ovary. So it's not that they're going to cut open. No. So even after an hour after the procedure, the person is able to go back to work with pain medication. They should be okay.
And once you have acquired the eggs, what's the process of preserving them?
All right. So once the eggs are retrieved and they're in the laboratory, then there's a process called vitrification that is done by the embryologist in the laboratory, where they quickly freeze the eggs. It's a specific procedure done by the embryologist. Once the eggs have been frozen, that is done immediately after the retrieval. Then the eggs are kept in some straws. They're called straws, which are then placed in liquid nitrogen. Then from there, that's fine until when the woman is ready to use the eggs.
And what are the straws? Is it like a tube? What is it? Is it the type of a fridge?
They are like small tubes.
Oh, yes. Small tubes. Okay.
Yes,
and how
like
long
tubes.
can you keep that in that particular condition before using them? Or does it take as long as you want? Because some women think they've got a time limit with how long they can freeze those eggs.
So with this new technology of vitrification, the studies are showing that it can be indefinite. And we have seen cases where even 10, 15 years later, the woman is able to use those eggs. You see, also, there's an aspect of age for the woman, because now if the woman kept her eggs at the age of 30, then also there's an aspect of age for her in terms of when she wants to carry the pregnancy. So if she kept the eggs at 30, then 10 years is an adequate time to thaw the eggs and use them for pregnancy.
All right. And when that woman is particularly ready to use those eggs for herself, the procedure itself, is that one invasive? Because we spoke about, getting the eggs out. When exactly are those eggs fertilized? Are they just going to go in the same position and can be fertilized either, through normal sexual interaction or maybe through, an insemination? How does that process go?
Okay, so it's important to understand that once the eggs have been retrieved outside the body, then the rest of the treatment has to be IVF treatment, which means in vitro fertilization. That means that these eggs have to be fertilized in the laboratory. So then the spouse or the partner will produce the sperm, which shall be used to fertilize the eggs in the laboratory. Once fertilization has happened, then we form what we call embryos. So now what we will return to the woman's uterus is the embryos already fertilized. So after fertilization, we return 1 or 2 embryos to the woman's uterus. So it cannot be insemination, it cannot be natural conception anymore. It has to be IVF.
I see. Well, this is quite informative, Dr. Eglay. I think many people who have thought about freezing their eggs, thinking about having children in their future, are much more informed about what the process actually looks like now.
Yeah, just one more question. In terms of people being going to the right places for egg freezing, how would you recommend them to find the right practitioners to do this in the correct way?
Okay, very important. So for egg freezing, it has to be a facility that has IVF, because then that's where we have the IVF laboratory. Then the eggs can be frozen because they're frozen in the IVF laboratory. So you cannot just visit a general gynecologist, for example, in their office, because they do not have that facility. So you have to see a fertility specialist who has access to an IVF laboratory, because that is the correct place where the eggs are supposed to be frozen. And subsequently, because your treatment will be IVF, then you can have your treatment in that facility.
All right, Dr. Eglay, this was such an important conversation. Thank you for helping us have this conversation, as I think there's a lot of things that we have debunked around people's fears, but also some of the stereotypes around egg freezing. Thank you for your time.
Thank you very much for having me.
That's Dr. Eglay Nyakoa, who is a fertility specialist, joining us from Nairobi, Kenya. Let's get our final edition of the morning sports. Fertility Specialist joins us.
Sports. on Channel Africa.
The African Perspective.